Today's webinar is presented in partnership with the National Immigration Law Center. Shelby Gonzales, Director of Immigration Policy here at the Center on Budget and Policy Priorities, is joined by Gabrielle Lessard, Senior Policy Attorney at the National Immigration Law Center. They will provide an overview of immigration status-related eligibility requirements for Medicaid, the Children's Health Insurance Program, and for enrollment to marketplace plans. And with that, I'll turn it over to Shelby.
Actually, first we're going to be hearing from Gabrielle Lessard, but I am going to say a couple quick words. One, that I know that within this climate of fear among families that include immigrants, I'm sure a lot of you have a lot of questions to ask us about various things and concerns that have been brought up to you by families already, I'm assuming, that are trying to enroll in coverage and may be fearful about what that would mean about their immigration status. And I just want to make sure that you all know that in today's webinar, we're going to focus only on the eligibility and enrollment for Medicaid CHIP in the marketplace coverage, as well as some specific application processes for groups. But next week, Gabrielle and I will be back, and we will go through some of the topics around fear and what's causing families so much concern right now about accessing public benefits. So we ask that you come back, and then there'll be a place there to learn more on that front. And with that, I really want to thank Gabrielle for joining us today, and turn it over to Gabrielle. Thanks, Gabrielle.
Thanks, Shelby. Good morning. I guess it's good afternoon for a lot of you. I'm going to start off by covering the immigration status rules for eligibility for Medicaid and the Children's Health Insurance Program, CHIP, and then Shelby's going to cover the marketplace rules. I'm going to be showing you a bunch of slides that have lists of immigration statuses. You are not expected to come away from this webinar knowing all the statuses or even which statuses are eligible for which program. This is just an orientation, and there are lists available on the Center on Budget and Policy Priorities website. So first of all, the immigrants that are eligible for Medicaid and CHIP in every state are a subset of lawfully present immigrants who are called qualified. This is a distinction that was created in the 1996 welfare reform laws. So qualified immigrants are generally lawful permanent residents. Those are people who are also sometimes called green card holders, as well as people with a number of humanitarian statuses. So they include refugees, people granted asylum, Cuban or Haitian entrants under the Cuban Adjustment Act or the Haitian Refugee Immigrant Fairness Act, people who are paroled into the U.S. with the parole expected to last at least a year. That's not criminal parole. Parole in the immigration law is a discretionary form of relief under which a person can be granted entry to the United States without having to go through all the processes to determine whether they are admissible. Amerasians, again, that's not everybody who's mixed race. It's specifically children of Vietnam-era soldiers in Vietnam and surrounding countries. And then Iraq and Afghan special immigrant visa holders. Those are for people who assisted us as translators or in other capacities during those wars. And people granted withholding of deportation or withholding of removal, which is a humanitarian status that's similar to asylum. Battered spouses as well, battered survivors of domestic violence, as well as the child of a battered parent or the parent of a battered child. And then people who have been granted T visas as survivors of human trafficking, as well as their spouse, child, sibling, or parent. There is also a qualified immigrant status granted to members of federally recognized Indian tribes, which are, of course, sovereign governments, or American Indians who were born in Canada. Now, in addition to having to be a qualified immigrant, many people also have to wait for a 5-year period, which is called the 5-year bar, before they're eligible for most federal benefits, and that includes Medicaid and CHIP. There are a number of exceptions to the 5-year bar. First of all, the 5-year bar starts when the person obtains a qualified immigration status. So for example, if somebody was here on a fiance visa and then became a lawful permanent resident, their 5-year bar would start running when they got that permanent resident status. The exceptions include people who physically entered the U.S. before the date that welfare reform law went into effect and who stayed in the U.S. continually until they got the qualified status, as well as the people admitted for humanitarian purposes, including refugees, asylees, people granted withholding of deportation or removal. And this exception to the 5-year bar remains in effect even if they become permanent residents later on. Cuban Haitian entrants, the Emiratian immigrants, people granted Iraqi or Afghan special immigrant status, and trafficking survivors also are exempt from the 5-year bar and remain exempt, even if they become LPRs later. And then qualified immigrants who are U.S. veterans or on active duty military status, as well as their spouses and unmarried minor children, people who have credit for 40 quarters of work earnings in the United States, which doesn't necessarily mean they've been here 10 years, because you can get it through your spouse or through your parent when you're a child. And then states have the option to exempt children and pregnant women from the 5-year bar. So again, this state flexibility, it comes about under the CHIP Reauthorization Act of 2009, and gives the option to cover lawfully residing children or pregnant women, which includes both the qualified immigrants and a broader group of lawfully present immigrants. Under this particular law, they're called lawfully residing because they have to be both lawfully present and a resident of the state. 2/3 of states have actually taken up this option for children, and nearly half for pregnant women. And NILC has some maps available that show which states have taken up those options. There's also a separate option through CHIP, which was actually introduced through guidance, that allows states to provide pregnant women medical services, including prenatal care, regardless of their immigration status. So those services are available even to people who are undocumented. And then in addition, states can cover additional groups of immigrants with state-only funds. So for example, my home state of California covers all children regardless of immigration status, as well as permanent residents and other qualified immigrants during the period that they are subject to the 5-year bar using state-only money. And then there is also an emergency Medicaid program, which provides Medicaid payment for limited services. Medicaid payment is available for services related to an emergency medical condition for people who meet all of the state's Medicaid eligibility requirements except for their immigration status. So they're residents of the state, they meet the income eligibility requirement. If they're in a non-expansion state, they also meet the categorical eligibility, but they don't have an eligible immigration status. So this is available to sorry, I got thrown off by that first line, which shouldn't be there. This is available to qualified immigrants who haven't met the 5-year waiting period, people who are lawfully present but not qualified, including people with temporary protected status, people who are undocumented, and even people who have DACA who are otherwise not eligible for Medicaid. So with that, I will turn it back to Shelby.
On the last, and just to clarify, on the last slide, can you turn it back over, Ina, really quickly, where Gabrielle was mentioning that there's something wrong. That first sub bullet should not be there. So we will, when we resend, and certainly when we post it on the website, we'll make sure that we make that change and any other changes that we see as we're going through the webinar. So thank you so much, Gabrielle. On the next slide, we're going to start turning over to the marketplace. So I'm going to go through marketplace eligibility, and in some ways it's a little bit easier, and then in other ways it gets a little bit more complicated when we start throwing in some specific examples of premium tax credit eligibility. So marketplace is less strict about eligibility based off of immigration status. There are no restrictions on U.S. citizens, just like in Medicaid. And immigrants are eligible if they have a status that's considered lawfully present. This includes everyone who's eligible for Medicaid based on their status. So all of those folks that Gabrielle talked about, they all meet this lawful present status. And many others that are listed on the right-hand side of this chart are also able to enroll, meeting the lawfully present requirement. So note that even though that there are people here that are listed with deferred action, and there is an exception, and those who have deferred action, DACA, they are excluded from being eligible for the marketplace coverage. But nonetheless, others who have different types of deferred action, they are included. So just like Gabrielle, I'm not going to be reading all of these to you. We do have this. This is a good resource for sure, but there's other resources that we have that go through different statuses that would make people eligible for the marketplace on our website. And on this slide, we also include some of the folks that are eligible when they're in the process of gaining status. So there are several times when different groups of people who are somewhere in the process of getting status that would also meet that the requirement for enrollment in the marketplace. So again, I'm not going to read this to you, but know that that's a good resource to have. And we're going to go through a quick example of how this kind of fits together with a scenario where we have Ricky and Ava and Karina. And this is a married couple, and they have a daughter named Karina. And Ricky became a lawful permanent resident 2 years ago, and Eva is a naturalized U.S. citizen. That means that she was not born in the U.S., but she later on became a U.S. citizen through going through what we call the naturalization process. And you have to meet a lot of different requirements, and then you could become a naturalized U.S. citizen. And Karina is a U.S. citizen, the baby or the child. And in this case, we have that all three of them are going to be applying for coverage. So in the next slide, we're going to look at, whether or not they are going to meet the requirements for the different programs, Medicaid, CHIP, and marketplace enrollment, based off of what we know about them in their immigration status so far. So right now we're only putting the citizenship and immigration status rules up here. So first, we want to know whether or not the individual, whether Ricky is applying for coverage. He is applying for coverage. He is not a citizen. His immigration status is lawful permanent resident. That makes him a qualified immigrant, right? That matters on the Medicaid side. He is subject to the 5-year bar. The next question is whether or not he has satisfied the 5-year bar, and the answer is no. Is he lawfully present? Yes. So since he does have qualified immigrant status, but he's subject to the 5-year bar and he has not met it, he's not going to meet the federal requirement for Medicaid enrollment. But he is lawfully present, correct? So he is eligible to enroll in a qualified health plan in the marketplace. Next, we can look at Ava and Karina's eligibility together because they're both citizens. So in this case, they're both applying for coverage and they're both U.S. citizens. There's no difference in terms of whether or not you're a naturalized citizen or you're a U.S. born citizen when it comes to eligibility for Medicaid and the marketplace enrollment. So that's all we need to know, that they're U.S. citizens. And then we know that in the case of mom, she would meet the federal requirement for enrollment in Medicaid based off of immigration citizenship status. And she would also meet the, you know, eligibility the specific eligibility requirement for enrollment in a qualified health plan as well. And for the daughter, Karina, she meets the requirement for Medicaid or CHIP, and also for enrollment in qualified health plans. So now we're going to walk through some other rules that come into play. Specifically, there's some rules that kind of would seemingly contradict other rules that we generally follow when we think about enrollment in marketplaces. So they're kind of tricky. And first, we're going to look at Medicare. Most people that are 65 years or older are eligible for Medicare Part A without any premium. Some people are only eligible for Medicare Part A if they pay a premium. People who are not eligible for premium-free Medicare Part A can purchase a marketplace plan and may qualify for subsidies if they are not enrolled in Medicare Part A. To qualify for premium-free Medicare, a person must have worked a certain amount of time in the United States and paid into the Social Security system and Medicare through their payroll taxes generally. And in general, people have to have 40 quarters, which equates to roughly 10 years of work credits. They can get credits for work that they completed. In most cases, they can also get credit for work completed by their spouses, or in some cases. So we're going to take a look at an example. We have Lynn, who lives with his daughter, May, and his grandson, Michael. And Lynn has been a lawful permanent resident for 4 years. He has never worked in the United States, and he has a small pension from work he completed outside of the United States, and he's not enrolled in Medicare Part A. May provides more than 50% of his support and claims Lynn on her taxes. She also claims her son as a tax dependent. So she has 2 tax dependents. So their household income puts them at 200% of the federal poverty line for a household of 3. Lynn is eligible to enroll in marketplace plans with subsidies at that level. And that's great news for Lynn. I do want to caution folks though, and I share this extra information because we get many, many questions every year actually from people across the country about situations like this. In this example, Lynn can't apply on his own for premium tax credits. If a person can be claimed as a tax dependent, they must indicate that when they're applying for health coverage on the marketplace, even if the person who could claim them as a tax dependent will choose not to. In this example, May can claim Lynn as a tax dependent because Lynn lives with her. She pays more than half of his support, and Lynn's income is below the gross income test. Since Lynn can be claimed as a tax dependent, he can't apply for PTC for premium tax credits as a household of 1. He must include May and her income in his application to figure out his eligibility. In this case, May, if she was not interested in premium tax credits or marketplace eligibility at all, she would make herself a non-applicant in the application process, as well as her son, because obviously she would have to provide some information about herself, about her son, the rest of her household to get the correct eligibility determination, but they can be non-applicants. So here's another rule that seemingly contradicts other rules that we know and hear about quite a bit when we're thinking about marketplace premium tax credit eligibility. So let's think about people who are lawfully present, but they're not eligible for Medicaid based off of their immigration status. So remember, Medicaid is stricter when it comes to immigration status. So people generally have to be in a qualified immigrant status, which remember is a subset of the people who are lawfully present, right? So lawfully present is a larger group. And they also generally have to have that qualified status for 5 years, or at least a lot of people who have qualified immigration status would have to have that status for 5 years before they can be eligible. So that leaves a whole lot of people out of being eligible based off of their immigration status. If a person is lawfully present but not eligible for Medicaid based off of their status, then they are eligible. They might be eligible, they meet all the other requirements for premium tax credits, even if their incomes fall below the poverty line. The bottom line here is that lots of lawfully present people in the Medicaid range, and even those whose income falls below the poverty line, may qualify for premium tax credits and cost sharing reductions. This is a special rule that was put into the Affordable Care Act because lawmakers wanted to make sure that everyone who was lawfully present in the United States had a pathway to get access to affordable health coverage. Lawmakers knew that lots of lawfully present people are not eligible for Medicaid based off of the strict immigration rules. So this was a way that they could get subsidies even if their income falls below the poverty line. So for example, we have another family. We have Gina and Adnan who are married, and Gina is from the Republic of Marshall Islands, a nation covered under the Compact of Free Association, which we refer to as COPA, or at least we will for this presentation, right? Adnan entered the United States as a refugee 4 years ago and gained lawful permanent resident status 1 year ago. Sam was born in the United States. Sam is their son. I forgot to introduce him earlier. He's a US citizen. Sam is already enrolled in CHIP, so we're only going to look at eligibility for Gina and Adnan, his parents, right now, okay? So Gina and Adnan both work part-time and they study, and we estimate that their income will be around $19,197 in 2020. That puts their household income just below the poverty line. First, let's look at eligibility for Adnan and Gina just based solely on their immigration status. So when we look at Adnan's eligibility, he is a lawful permanent resident, but importantly, he entered the US as a refugee. Refugees are a qualified status that are not subject to the 5-year bar. So even though Adnan has only been in the US for 4 years, he may be eligible for Medicaid based on his immigration status. Because as a refugee, he does not have to meet that 5-year bar restriction. He doesn't have to wait. And even when he adjusted his status to become a lawful permanent resident, he didn't lose his refugee status. So Adnan could be eligible for either Medicaid or marketplace enrollment, depending on household income, which we will talk about in the next slide. Gina, let's look at her eligibility. She's from the Marshall Islands, and although she does not have a qualified status, her status is considered lawfully present. So Gina is eligible for marketplace enrollment based off of her immigration status, but she does not meet the more restrictive Medicaid eligibility requirement. So now let's put it together and look at the fuller picture of what programs Adnan and Gina are eligible for in terms of help to pay for health coverage, right? So let's look at their income as well as their immigration status. So to keep this example a little simpler, let's look at eligibility, how eligibility would play out for this family in a state that has expanded Medicaid. So as a reminder, Adnan and Gina project their income to be a little bit over $19,000 this year. It puts them just below the poverty line. Adnan is eligible for Medicaid, as we discussed on the previous slide. He meets the immigration requirement, at least. He has a qualified status and is not subject to the 5-year bar. His income is below 138% of the poverty line. And since he's in a state, in this example, that has expanded Medicaid, he would meet the Medicaid eligibility requirement. Gina, although she has the same household income as Adnan, she's not eligible for Medicaid because she does not have a qualified immigration status. Normally, people with income below the poverty line are not eligible for premium tax credits, but as we explained earlier, there are protections for immigrants who are ineligible for Medicaid due to their immigration status. So Gina is lawfully present, so she is eligible for coverage in the marketplace, and she's ineligible for Medicaid due to her immigration status. Because of this, she does meet the eligibility requirement for premium tax credit, even though her income falls below the poverty line. We also wanted to include some information about non-residents that are married. To qualify for premium tax credits, an applicant that is married must file jointly with their spouse. And generally, you cannot file as married filing jointly if either spouse was a non-resident at the time during the tax year. However, non-residents married to U.S. citizens or residents can choose to be treated as U.S. residents and file a joint return. So a citizen or resident married to a non-resident who does not choose to be treated as a resident may also file as head of household if they support a child or another closely related person. So we have more information in this link through the IRS publication. So it gets a little tricky for families when they have these kinds of restrictions. And we just wanted to point this out to folks, because remembering that filing taxes is a requirement in the application process. And if, to the extent that people are married, filing jointly is also a requirement to be eligible for premium tax credits. So just wanting to make sure that people know how this all plays out. We also wanted to talk a little bit about state residency for Marketplace and Medicaid and CHIP, mainly because we get a lot of questions about this and how it interplays with immigration status. So in general, to be able to enroll in a qualified health plan or Medicaid or CHIP, the residency is the state in which a person actually lives, intends to reside, including without a fixed address, and there's no kind of requirement that somebody says, and I plan on living here for this many months, or there's no requirement that the person had lived there for X number of months either. That's important to know. I can decide to move to a state, and that's my state, and I intend to stay, or intend to reside, and I don't have to say for how long. It's my state. I also don't need to have a fixed address. If I'm somebody who doesn't have a home, I don't have to provide a fixed address either. A person who is entered with a job commitment or is seeking employment, whether or not they're currently employed, will also meet that requirement. So to verify residency and also for Medicaid and the marketplaces, states can accept self-attestation. They can use HHS-approved electronic sources to the extent that they exist. They can't ask people to provide proof of their immigration status in order to meet this requirement. So if that's something that you see happen, that's important red flag. That should not be happening. Okay, we're gonna quickly go through some options for people who are ineligible for insurance affordability programs. And when I say insurance affordability programs, I'm talking about Medicaid Children's Health Insurance Program, CHIP, and help for paying for the marketplace eligibility. So there are people who, you know, since this webinar is about eligibility based off of immigration status, you might run into people who, you know, sometimes you have a family that includes both people who are going to be eligible for marketplace or Medicaid coverage, as well as people who won't be eligible for anything because they don't meet the immigration requirement. So people who are undocumented or people who have DACA are examples, and they are ineligible to purchase qualified health plans in the individual marketplaces, even without any kind of premium tax credit or cost sharing reduction. So they can't purchase it at all in the ACA marketplaces. They can purchase private coverage outside of the marketplace, so they can get coverage through an employer. So for example, let's say that I'm undocumented and I'm married to somebody who's working at Acme. I can still get health insurance from my husband's employer. That's an example of one way people can get coverage. Other ways is that you could get coverage in the individualized market. You can apply for health insurance for eligible family members and be part of a household for of eligible family members. So remember how I mentioned that it's not unlikely that you'll run into some families that include plenty of people within that family, maybe everybody except for one person, who meets the citizenship and immigration status requirements. They can go ahead and apply for health insurance, even if they are the head of that household, so to speak. Oftentimes you'll hear about maybe parents applying for their children, or maybe one spouse, is applying for themselves, but their other spouse isn't eligible. That kind of thing can happen. So if the tax filer is applying for premium tax credits on behalf of eligible family members, that person must file a tax return. So if they're getting marketplace coverage for family members, they are the tax filer. They must file a tax return. If they're not eligible for a Social Security number, they may file the tax return using an individual taxpayer identification number. And they may be eligible for programs that are available to all, which I'm going to go through in the next slide. So, again, when you're helping a family that's in a situation where one person is not eligible for benefit programs based off of their immigration status, you want to do what you can to make sure that they know that there's other services available. And Medicaid payment for limited emergency services is certainly one of those avenues to get coverage when somebody has experienced an emergency. Those services can be paid for if they meet otherwise all of the Medicaid eligibility requirements. That's a big if, right? Because Medicaid's eligibility is pretty stringent. There's a lot involved in it. But if the only reason that they're ineligible is their immigration status, then that is one avenue to pay for emergency, life-threatening or just emergency services. Programs using federal healthcare block grants, such as the mental health, maternal and child health, family planning, some communicable disease immunization programs. Those are all eligible. Those are all examples of federal programs that don't have a citizenship or immigration status requirement. And there are some programs that are providing health services necessary to protect life or safety, such as emergency medical, food and shelter, mental health crisis, domestic violence. There's some programs available for people who are survivors of crimes, or also people who are survivors of a disaster. So there are different avenues for different types of people who have gone through some big challenges, right? In those programs also would not be looking at someone's immigration status or citizenship status. Hospitals have financial assistance programs or also or charity care that people can apply for if they experience large medical expenses. There's a whole process available, and people would have to ask to go through that process to see if they can get help with medical expenses that they incur when they are in the hospital. There's also community health centers, federally qualified health centers, and migrant health centers that provide health services on a sliding scale fee depending on someone's income, again, without regard to immigration or citizenship eligibility. They provide services to everyone. In fact, they provide services to people who have health insurance. You can be, I could decide to go and use those services with my health insurance I get from my employer. And then there's some additional programs in some states, and Gabrielle gave an example of how California has some programs that go beyond what traditional federal funded programs would go into. We're going to pause for a little bit before we go into the next section where we're going to talk about navigating the application process. And both Gabrielle and I are available for questions now.
Great. So we do have a handful of questions. Are adults with refugee or asylee status subject to the 5-year bar?
Gabrielle?
Hi, this is Gabrielle. No, both children and adults with refugee and asylee status are exempt from the 5-year bar.
Great. And what kind of documentation is needed for refugees and asylees to prove their status?
So refugees and asylees will have a variety of different documents. They will have an I-94, which is the document that you get when you enter the country, that will have a code on it that indicates that they're a refugee or an asylee. They will also generally have an employment authorization document with a code that indicates they're a refugee or asylee. Asylees will have also a notice that they've been granted asylum, or actually a copy of an order granting them asylum.
And we will, in the next section, talk about data matching issues and different forms of verification as well. We'll have some lists available, and that's another resource that you can look at and use as you're helping families and individuals enroll in marketplace coverage.
Great, so a couple more questions here. For individuals who are qualified immigrants due to domestic violence, are they required to prove that domestic violence occurred?
Yes, they're required to provide some form of proof, but that determination is made by U.S. Citizenship and Immigration Services, USCIS, and they are required by the law to consider any credible evidence, which includes affidavits or reports from police, judges, other law enforcement, healthcare providers, school officials, clergy, social workers, any kind of social service agency personnel, as well as evidence that they've sought an order of protection or taken other legal steps to end or document the abuse, which could include seeking refuge in a shelter, consulting with a psychologist, or maintaining photographs showing the injuries.
Thank you so much, Gabrielle. And so the big thing there is that that's not a determination that's happening at the marketplace. That's happening right when the person's getting, and that's how Gabrielle started. I just wanted to just re-emphasize how important that is, that that's not a role at all that you should get involved in, because that has already happened. If somebody's told you, you're just taking the document numbers and putting it into the application, it's not your role there's nothing that you have to go through in the application process to further prove it.
That's right. And somebody asked me about withholding, and similarly, the person will come to you having been granted withholding of removal.
Mm-hmm.
One more question. Are there any programs available for undocumented immigrants with a continuing illness, such as cancer?
It depends on the state. So, for example, here in California, we have programs for specific cancers, breast and cervical cancer, as well as prostate cancer. But a person who had colon cancer would just have to rely on the availability of charitable assistance.
Yeah, and part of their care might come from a federally qualified health center, or community health center, but you know, as you can imagine, that could be a huge challenge still, because somebody with such a severe set of circumstances oftentimes has to see a variety of specialists, a variety, like in and out of the hospitals, and in and out of getting care that would be outside of most community health centers at times, which would make it very difficult to have a whole patchwork of different systems, different processes, and applying for financial assistance and charity care from different places. So, you know, there are some communities that do an amazing job at putting that all together, so that people can seamlessly go through and get the kinds of services they need. You know, because they've recognized that there's this gap, but it's unfortunately going to really depend on where somebody lives and what kind of local resources have been pulled together, and in some cases state resources, like Gabrielle mentioned.
Great.
So now we're going to go back into the next section of of talking about navigating certain aspects of the application process that are particularly relevant for families that include immigrants. So we're going to talk about verification first, and I want to take a moment to mention that that we will also go, you know, that we also already a couple weeks ago, I think it was, we went into data matching issues in more detail in another webinar, and that webinar can be accessed on our website. So we're just going to take, you know, quick look into verification here. So Medicaid CHIP and marketplaces require verification of citizenship and immigration status. When completing the application, consumers attest to being either U.S. citizens or having an eligible immigration status, and they provide relevant numbers. Including, you know, people are always asked that are applying for coverage if they have SSNs, and if they do, they provide them. They're also asked if they have, you know, if they identify that they have an eligible immigration status. They're also asked to provide immigrant document numbers, and that information is then matched against information that's available to either the Medicaid agency or the marketplace or CHIP agency. They use those numbers to compare it with information that's available in other data data sets that are housed by the government. So that includes the Social Security Administration, which can look at and see if they can substantiate somebody's attestation of citizenship, or the U.S. Department of Homeland Security, which has a data set or data system called SAVE, and an individual, they will look at both whether or not they can substantiate somebody's attestation of having an eligible immigration status, or a naturalized citizen. They can also do that. And when it works, it's terrific, because then applicants don't have to then provide, you know, lots of documents to prove their status. But it doesn't always work. And when it's unsuccessful and a person is said to have a data matching issue, which we often refer to in shorthand as a DMI, it doesn't mean that they aren't giving the right attestation. Oftentimes there's a variety of reasons why a data matching situation might happen. Sometimes people don't provide a social security number or the numbers on their documents, or they provide the wrong number. And to be honest, it's not always easy to figure out which number they're asking for. So it can be confusing at times, especially when you're looking at immigrant documents. There's a lot of numbers on those documents. It's such a small little document, a whole lot of numbers, and it can be difficult to pinpoint which ones to provide. Sometimes the name, date, or birth and social security number provided in the application don't match up with what SSA or SAVE has in their records, and that can be for a number of reasons. That can be a typo. I've certainly talked to a lot of people who, they couldn't figure out why they keep on getting a data matching issue, and come to find out that it was just, mistyped in one of the numbers or a few of the numbers when they were applying for coverage to Marketplace Call Center. So it could be something as easy as that. It could also be something like a name change, right? Like people get married and they changed their name, and the first thing they did, they did not go, immediately over to Social Security Administration to alert them about their name change. Like those things happen, right? And then there's some data limitations. The Social Security Administration can't verify citizenship for many citizens who are born outside of the US. So that could be a naturalized citizen. So for example, somebody who, they got their Social Security number when they were lawful permanent residents, and later on became a naturalized, they went through the process to become a naturalized US citizen. That SSA hasn't verified their citizenship. They were born outside of the US. They aren't able to figure, always have updated information about someone's status. Another example is that Social Security Administration didn't, they have some limitations on people who are older and were born outside of the US, even if they were like a derived citizen. So oftentimes, for example, military might have a child born overseas, and they get derived their citizenship while they're overseas. SSA might not be able to verify their citizenship. And then SAVE, the Department of Homeland Security system, there's just certain immigrants that they're just not going to be able to quickly or sometimes ever verify their immigration status. In those cases, people will get data matching issues. And when that happens, it's not like, people are told. It's not like a surprise to them later on when, this happens. They're told pretty much immediately. There's a warning that comes up in the application on healthcare.gov, for example, that says that you have temporary eligibility, and then gives a date by when you need to provide some evidence, and then in the eligibility determination notice, more information is provided about what's the reason behind the data matching issue, what kind of evidence can you turn in to satisfy the verification requirement. And they also don't stop there. They will also send, and I'm talking about they being healthcare.gov, every state marketplace will probably do it a little bit differently, as will Medicaid and CHIP. But in the case of healthcare.gov, people who have data matching issues, so that they have this temporary eligibility, they are able to go ahead and enroll in a marketplace plan. But they're told again that their eligibility is temporary, and then they're given this notice, or given the on-screen notice. They also get other notices in the mail. They get emails. They might get phone calls. There's all sorts of ways that the marketplace will try and alert somebody that they have to take some action. Ways to kind of prevent data matching issues, or to correct a data matching issue. It's to make sure that the attestation's correct, which you'd be surprised. But the way that the questions are asked are sometimes a little bit opaque, and it can confuse people. So, if somebody is not a US citizen, they shouldn't indicate that they're U.S. citizen, and this could happen by mistake just because of the way the questions are asked. It could be a little confusing. And so, you know, your role as somebody who's helping people enroll is make sure that the right attestation is done. Enter all the numbers that are required for applicants. So to the extent that you have the numbers, it's really important to do that because, you know, trying to prevent people from having to go down the route of then providing documentation, that's a good thing. You know, and if somebody has changed their name, there is an avenue for providing this new information in the application, and then that will help also with data matching. We provide here a lot of another list. This is, again, I promise that I'm not going to read this list, but to the, you know, question that was asked beforehand, you know, taking one more step further, like here's a bunch of different document types that an individual could identify that they have. And then based off of the document type that the individual identifies they have on the application, then they will be asked to provide very specific information from their document. And, you know, like I mentioned, it's not always super clear you know, which number to provide. So we also, in addition to having this table that kind of walks through what kinds of numbers you're looking for, we also have another resource, and so does healthcare.gov, where they walk through some places on different types of documents that you might encounter and where to look for specific numbers. And then they have some on healthcare.gov some tips about you know, there's a certain number of characters you must provide in certain fields. So healthcare.gov has kind of like some workarounds and what to do to provide like extra characters if somebody has an older card that doesn't have that many characters, and we have that written down here. But we also have a resource on our website on Health Reform Beyond the Basics. We also have some tips for resolving DMIs. So when people get a DMI, they have to, well, they could mail in documents. They can also upload documents, and uploading documents, we're told over and over again, is much, much, much faster than mailing in documents. But then there are certain restrictions and certain things that you want to keep in mind in terms of the file size and how you save the file and how you name the file. So I'm not going to bore you by reading all of this, but you do want to take a look at all of those instructions to make sure that you're you know, following all the instructions so that the file actually makes it successfully there. Another thing to keep in mind is that when resolving data matching issues, U.S. citizens are oftentimes going to need to provide more than one document, unless they have something like a passport, which can prove both their citizenship as well as their identity. Then they're likely to need to provide two different evidence, you know, two different pieces of evidence, one for citizenship and one for identity. And I provide you a list of those kinds of documents here. So this here in this slide, you have a whole list of different kinds of documents that can satisfy both the citizenship and identity. And here you have on the left-hand side a list of documents that can satisfy the citizenship requirement, and on the right, documents that can satisfy the identity requirement. So DMIs can be really difficult for certain lawfully present immigrants, and I'm going to go through some slides that get pretty into the weeds. You'll remember earlier in the presentation, we talked about lawfully present people who are eligible for premium tax credits even if their income is in the Medicaid range or below the poverty line. So these are people who are ineligible for Medicaid based off of their immigration status, right? So for these people, if they don't have a DMI, the application again, when I refer to the application, talk about healthcare.gov, it generally works for them and they will get the correct determination of eligibility for the premium tax credits. However, if they do have a data matching issue, things get kind of challenging. And a lot of people in this circumstance do have a data matching issue. So important to know that. So generally, if a person has a DMI, the application takes the person's attestation, right? And then allows the person to get benefits for a few months, giving that person time to send in documents to prove their circumstances. So we just went through that, right? That's generally how things happen. But in the case that a person is an immigrant and the person has a DMI, the application assumes that person has an eligible immigration status for the program that their income would put them in. So if that person has income below 138% of the poverty line in a state that has expanded Medicaid, we'll assume this person's an adult in this case, right? Healthcare.gov would assume that this person is eligible for Medicaid and would send this person to Medicaid. If the person has income below the poverty line in a state that does not expand Medicaid, healthcare.gov either assumes the person is in the coverage gap, right, that Medicaid coverage gap, or healthcare.gov may assume the person is Medicaid eligible if the person is otherwise eligible for Medicaid. So here I'm giving you an example of like maybe a child that meets the immigration, meets the income requirement, or it could be a parent who has income that appears low enough that they look like they would be Medicaid eligible. So what's happening here is basically healthcare.gov is wired to make an eligibility determination based off an attestation of either being, when we think about immigrants, right? They're making that, they're assuming that you're eligible. When you say I have an eligible immigration status, they're assuming that the highest level of immigration status that would, or at least that you met the mark to qualify you for the program that you would otherwise be eligible for based off of your income, okay? So here's what happens when the application thinks a person is eligible for Medicaid, right? The case is sent to the state Medicaid agency. The applicant is asked to send in proof of their immigration status. And if the applicant turns in documents and the agency finds the person is lawfully present but is ineligible for Medicaid due to immigration status, then that person is denied Medicaid eligibility and the case is sent back to the marketplace. The marketplace will notify the consumer to come back to the marketplace and will provide instructions on how to get the correct eligibility determination. But as you can imagine, this is very confusing to individuals, right? Because it's already, anytime you have a transition between the marketplace, right? I went to the marketplace to healthcare.gov. I applied for healthcare.gov. I don't even know anything about Medicaid, maybe, right? And then I'm sent to Medicaid and I get some notices that might be difficult to read. And then eventually I send in documents because I understand that I'm supposed to send in documents to prove my immigration status, and then Medicaid processes them. A lot of time now has passed, and then Medicaid says I'm ineligible based off of my immigration status and then sends me back to the marketplace. Now I've been denied eligibility for 2 times, and then I'm still not quite getting an eligibility determination done without taking a bunch of other steps. So I'm laying this out because this is a place where people need a lot of help in making their way back to the marketplace. This is a new question that is, or a new set of questions that are similar to what we've seen in the past, but these are the questions that individuals will use to identify that they've been determined ineligible for Medicaid based off of their immigration status. So when they come back to the application, it's the way, you know, now that they've been denied Medicaid eligibility, this set of questions, by how they answer them, should clear the hurdles for somebody who indeed was eligible for marketplace coverage with high, you know, with subsidies, even though their income is in the Medicaid range or below, even if it was below the poverty line. So, okay, if in the last, I think my last slide, yes, I think it is. If the applicant has income below the poverty line and does not otherwise appear eligible for Medicaid, then the marketplace determines the applicant can enroll in coverage without any premium tax credit and notifies the applicant that he or she may qualify for help paying for coverage, but that proof of status is needed to make that determination. So unlike everybody else that gets, you know, that might have a DMI in the marketplace, right? Based off of their immigration status. They might have a data matching issue, but in the meantime, they have a little bit of time to like get their paperwork together and process, and they can get premium tax credits during that time. This group can't. They have to, they're not gonna get any premium tax credit until they prove to the marketplace that they're ineligible for Medicaid based off their immigration status. So in this case, an applicant sends in their proof. The case is then sent to a special unit that they're going to be looking to determine that the person's ineligible for Medicaid based off of immigration status. And if the person is determined ineligible for Medicaid based off the immigration status, then the marketplace will notify the applicant about the eligibility for premium tax credits and cost sharing reductions and for special enrollment period to enroll in marketplace coverage. The applicant then returns to the marketplace and then they select a plan again. So we have talked quite a bit. We also have a lot of resources, both NILC and CBVP. We have a lot of resources that can provide you some additional information in healthcare.gov. They also have a lot of resources as well on helping people navigate through the application system. We have a few webinars coming up quite soon. And we, one of them I mentioned already. I know that's where all the questions are really coming in from right now. People want to know about public charge and about other concerns immigrant families are having and immigrants are having when they're applying. I want to thank Gabrielle and NILC for their not only participation in this webinar and for next week's webinar, but their ongoing partnership with us and helping us to, you know, work and navigate through a set of really complex eligibility requirements, both on the benefit side as well as on the immigration side. You know, families that have two worlds and many others, right? Because we have lots of things that we all juggle in our lives. But families, when they're applying for benefits and they're having to make considerations that go beyond just the benefit eligibility, it becomes a little bit more complex. And the National Immigration Law Center has helped us untangle this and understand this for so many years. And I just really want to thank them for their partnership. So thank you, Gabrielle. I don't know enough. We have.
Thank you.
Thanks.
So thank you so much, Gabrielle, and thank you, Shelby. As a reminder, we'll be distributing the materials from today's session via email, and we'll post everything to the Beyond the Basics website at www.healthreformbeyondthebasics.org. As Shelby mentioned, the next part of this webinar series will cover working with immigrant families and public charge. It's scheduled for next Tuesday, October 29th at 2 p.m. Eastern, 11 a.m. Pacific. You can register for upcoming webinars on the Beyond the Basics website under upcoming webinars. You can also find additional resources on the website, including reference charts, guides, and frequently asked questions. If you have questions or need assistance, please email our Beyond the Basics contact email at Beyond the Basics at cbpp.org. And with that, we'll bring today's webinar to a close. Thank you again for joining us today.